Hey everybody, it's Jay, trying something a little new here. Let's see how it goes. COVID-19 is going to have lasting effects in so many ways that are just starting to emerge. One of these is telemedicine, also called virtual health. It's not a new concept at all, but there's been varying levels of adoption over the past decade or so, many supply-side barriers such as reimbursement and regulation. Something I'm thinking a lot about recently is the demand side. Looking at virtual health, a video visit, for example, through the jobs to be done lens and the forces of progress. For many of us, our context and even the kinds of progress we're trying to make has shifted dramatically and quickly. Many people have had anxiety over using virtual health in the past. I've interviewed people over the years who weren't sure it would work, and they didn't know how it would work. In some cases, just setting up the initial account seemed like too much of a pain. So historically, many people, the sum of the pushes and pulls didn't exceed the sum of the habits and anxieties, so they would stick with in-person care, or perhaps do nothing at all, which is what we call non-consumption. But now, necessity is the mother of invention, and the magnitude of the pushes and pulls are overcoming the degree and influence of our habits and anxieties. The need to stay home, the need to keep our loved ones safe and healthy, the need to know if a cough or a fever is a cold, the flu, or perhaps COVID-19. These pushes and pulls, coupled with the increased awareness that virtual health works, thereby decreasing historical anxieties, helps people select the new way, getting care virtually. What I'm going to be really fascinated to see is when we get through this initial wave of COVID-19 is how virtual health gets instilled in our habits. Habits are such a strong force, perhaps the strongest of the four forces of progress. Once they're set, they're really hard to break. Be well, everyone. I'd love to hear your thoughts on virtual health, particularly through the lens of jobs to be done.